Welcome back to Talk of the Town, and we have a returning guest, Phil. We'd like to welcome you back, Dr. Thomeer, and you are joined by your fellow doctor, Jim Donnelly.
Thank you.
Welcome back, and of course you're from Canisius College, and you head up the IAR. So you need to tell us all, what's the IAR?
The IAR is the Institute for Autism Research. So we conduct research programs, treatment programs for kids with high functioning autism spectrum disorder, but we also study the characteristics and features of autism.
And you're offering treatments for kids with high functioning autism, and these are treatments that have, I hope I'm saying this right, empirical data that backs up that this is treatment that has fruitfulness to it.
Yes, yes. So everything that we do is the treatment programs are always research programs. So we're evaluating to see if they make a difference. Because you know, if I'm a parent of a kid with autism, my job is to do anything I can to help my kid. So our programs are always our programs are set up to evaluate, do the things we do they make a difference? And so for like our summer program, we've been doing, it'll be our 14th summer this summer. We've been doing it for 13 years, and we have clinical trials, so where we have a group of kids that get the treatment, get the program, and another group that don't, and we're able to show that the kids that get the treatment make significant gains in targeted skills, so skills that we're teaching, which you would hope that you would get improvement, but more broader social skills, so things that we're not teaching directly, but we see improvement in the kids, and then we even show reductions in autism symptoms. So we're not curing autism, we're not claiming that at all, but it makes sense is if you improve the social functioning of kids, that's one of the core deficits of kids with autism.
Right.
And you know, when we say the word, we say it's a research study, it's when the kids come, they see it as an after-school program or a summer program. It's not like, welcome to another day of clinical treatment.
And you mentioned the after-school program, and gentlemen, you have an after-school program that's about to begin. Tell us what is happening there.
The after-school program that will be we're starting it now. It's twice a week. It's also a research study, but the kids will come twice a week on Mondays and Fridays for 90 minutes, and we're going to work on social skills, face and emotion recognition, the ability to read nonverbal cues, which is a problem for kids with autism. We'll work on interest expansion, getting these kids to talk about other things besides those narrowly defined areas of interest. And then we work on what we call the interpretation of non-literal language. But all that is idioms, you know, getting them to understand that it's not just the words people say, or getting them to understand when somebody says something that doesn't make sense, it probably has an alternative meaning. That's what we want them to learn.
Right. Dr. Donnelly, so fill us in a little bit. This is our first time meeting with you, and so kind of bring us up to date and on how you fit into all of what's going on here with Canisius College.
Well, thank you very much. Actually, Dr. Thomeer described a lot of what I do, which is to help with the data analysis and the research design. So whenever we want to conduct a study, we have to think through what's the concept involved, and then how does that translate into practical procedures that kids would be able to participate in, that families would support, and that would kind of represent the cutting edge of how we help the kids grow and improve. And and just it's science takes time. So this particular study Dr. Thomeer just described is going to take 4 years to actually collect the data. We'll have some idea, as we go, how things are going along. But as usual, you have to kind of wait and see how everything comes out, and then we try to evaluate the data as thoroughly and fairly as we can.
And for the folks at home who are watching, that I would think that your program is going to spark a lot of interest. And what can they do, and how do they get involved in your program?
They can visit us, canisius.edu/IAR, IAR for the Institute for Autism Research. They can call us at 888-2800, or they can email us, iar@canisius.edu.
I think a lot of times, we see, Phil, that people can be quick to kind of lump disabilities into one umbrella. I think a lot of parents and a lot of professionals are kind of looking at autism as an unofficial diagnosis, where you're hearing people say, "Oh, I bet they have autism," and why do you suppose that's beginning to happen now? And are there particular characteristics that would define this individual does or does not have autism? It's not just a misbehaved child.
Yeah, it's not just, it wouldn't just be a misbehaved child. I mean, the core characteristics would have deficits in social and communication, social interaction. So being able to read nonverbal cues, you know, like now you're looking at me and I'm saying things that I hope make sense. But if I said some crazy stuff, you know, like there's a monkey in the studio, you'd be like, what's he talking about? And that's information. It's not just the words you say, but what you do with your body language, with your facial expressions. So it's an inability to read nonverbal cues. It's an inability to display emotions that match the situation. They may be very excited that they're doing something, but then you look at them and they look bored to tears. They tend to take things very literally. They might have narrowly defined areas of interest where they can, you know, tell you everything you didn't want to know about something in great detail, or have an interest in some object or action, and that's what they want to do a lot of, or engage in that activity a lot. Have difficulty sometimes with being oversensitized or undersensitized to different stimuli in the environment. The routines and schedules, if their routine or schedule gets changed, that can throw them for a loop because they expect it to happen this way, and if it doesn't happen that way, that can cause them problems in how they respond.
Now, we've talked about this before, but there seems to be an uptick in the number of cases that are diagnosed as autism. Is that because of better diagnosis, or is there actually a growth in the
real numbers,
prevalence of this happening?
The prevalence for the CDC is 1 in 68 kids are going to be identified with autism. Yes.
And how was that a generation ago?
Well, it used to be 1 in 1,000, then it was 1 in 1. I mean, there was it's slowly going, you know, the rates have definitely increased. The main reason is what you said, better diagnostic, more people are informed about it. They also, the increase over the last several years has been as a result of catching those individuals that have cognitive and language skills, but that have significant social deficits in terms of their social communication and social interaction.
So this isn't necessarily a growth in the prevalence of autism, it's more in the recognition of?
I think it is more recognition identified. Doctors, pediatricians, family doctors, psychologists, social workers, school people are more informed of what the characteristics and features are. I mean, just because I might tell you everything you didn't want to know about the bills doesn't mean I have autism. You know, just because you have a narrow interest. Just because you make a happy face and I like, what are you talking about, or get confused, doesn't mean I have autism. You'd really, it would take a more thorough evaluation where you go through the person's development and look at their social and communication interaction from early on in their life up to where the present, you know, where you're seeing them at the present time.
Now the IAR, you offer your programs to what age groups?
We actually, I'm glad you asked that, because we traditionally have done 7 to 12-year-olds, so we've been doing our summer program that has the clinical trials. We have a school-based program we're doing now, but just last summer, we started a program for 4 to 6-year-olds. So getting those kids with autism that have language and cognitive skills, but have significant social interaction deficits. We started a program, it's adapted from our summer program, but it's only 6 hours a day as opposed to 7.5 hours a day. The kids love it. It's a lot of teaching skills and then giving them opportunities to practice.
Well, I can tell you my son went to the summer program and he did. He loved it. It was like camp, you know, you're teaching these young ones without them knowing they're being taught, which is just ideal, isn't
right.
it?
Exactly.
And when we come back, we have some guests who are here to see you. Some students, some hometown students who want to help your program, who want to help the individuals who attend your program. And so stay tuned.
This will be
Great.
fun.
Thanks.